The general topic of healthcare is elusive and complicated, making itself nearly inaccessible to the modern consumer. This makes the concept of prison healthcare systems all the more confusing. Our video aims to educate the viewer on the intricacies and injustices of the prison healthcare system and answer as many questions as possible about how the system fails our inmates. First, we begin with a few statements taken from the Nevada Department of Corrections in order to get an idea of what our state provides for our inmates. To provide quality, constitutionally mandated health care using an efficient system of managed care that is professional, humane, and appropriate, and in support of the mission of the Nevada Department of Corrections. The medical division sees medical problems similar to any that exist in the outside community, ranging from major to minor problems, acute illnesses or injuries, to ongoing care for chronic diseases, and preventative health care to end-of-life care. Each major institution has a medical and dental clinic and some infirmary capacity. There are 2 institutions with on-site acute care infirmaries with approximately 91 infirmary beds. The medical staff engages in over 600 patient care contacts every day statewide. The medical division provides primary care at each institution, and on-site clinics are held periodically with outside specialists such as cardiologists, surgeons, and gastroenterologists. The medical division also provides hospitalization in community hospitals when necessary. The medical division is administered by the medical director and medical administrator, who are responsible for the medical, dental, clinical mental health, and pharmacy services and policies throughout the department. The medical facilities in each major institution are staffed by licensed health professionals. The medical director supervises the clinical staff and operations of medical, dental, clinical mental health, and pharmacy services. Nursing departments and operations are supervised by 2 divisional chiefs of nursing located in Carson City and Las Vegas. The central pharmacy, located at the Casa Grande Transitional Housing Center in Las Vegas, is supervised by the chief of pharmacy. The division's administrative offices are located in the department's central offices in Carson City. The nearest correctional facility to UNLV is the Florence McClure Women's Correctional Facility, which raised the question of how women's health care in prison may vary from a standard men's prison due to the addition of women's health needs. While this facility was not available for an interview, we were able to gather some research on a women's prison in New York in order to answer some frequently asked questions about how female health needs are being handled in a prison setting. A study done in 2015 put forth by the Correctional Association of New York found that incarcerated women have received poor quality reproductive health care and are faced with a lack of basic human dignity and rights. There are approximately 112,961 women in prison in the U.S., with 2,413 of those in New York State prisons. Out of the many reproductive health issues women in prison face, gynecology exams and sanitary supplies are of the most problematic. The policies in this area are outdated, lack specificity and/or written policies, and fail to follow standards put out by the medical community. Reproductive health issues may include, but are not limited to, gynecology exams, sanitary supplies, and having access to contraceptives. Initial health exams do not distinguish between men and women and therefore do not offer pap smears, breast exams, pregnancy testing, or gynecology care, nor do they offer information or follow-up medical care. Unlike the jails and penitentiaries, state correctional facilities do distinguish between men and women, but do not offer pregnancy testing, and certain policies do not comply with medical standards. For instance, the Department of Corrections and Community Supervision policy states that women over 30 should have annual gynecology checkups. This policy is not in line with the American College of Obstetricians and Gynecology, which states that pelvic exams for women begin at the age of 21. Policies are vague, stating that, quote, all female prisoners will be provided with necessary feminine hygiene items in order to provide for the special hygiene needs of females, end quote. This policy fails to state the quantity and frequency of the feminine hygiene items. There are many problems we are faced with when having unclear and poorly written policies as vague as these. We are very likely to face medical issues as well as lawsuits. In the case of Estelle v. Gamble, the Supreme Court stated that, quote, deliberate indifference to serious medical needs of prisoners, end quote, violated the Eighth Amendment, which prohibits cruel and unusual punishments. New York's policies are lacking in comprehensive and consistent guidelines and must be brought up to the DOCCS attention for reform. The DOCCS has the authority to introduce and apply rules and regulations to implement laws by the New York State Legislature. Therefore, it is only a matter of revising and improving our policies for our women in prison. Now looking in a more broad perspective, we begin to look at what similarities or differences one might find with the general healthcare system versus prison healthcare systems. In most states, inmates would be on the hook for co-payments ranging from a few dollars to as much as $100. The Federal Bureau of Prisons permits inmates to be charged co-payments for medical services. An estimated 80% of prisoners are considered to be living in poverty. Medical co-payments typically come out of their commissary accounts, funded by money from families and earnings from prison jobs. They typically get $20 a month from family. If they deplete that from medical care, they won't have money for underwear, soap, food, etc. The prison announced that if a doctor orders Tylenol, a topical cream, or other over-the-counter treatment, those items will have to be purchased by the prisoner with their commissary funds, rather than provided through the prison's medical service. Most states have turned to telemedicine to some extent for treating prisoners, often in remote areas where many prisons are located, because it allows doctors to examine them from a safe distance. A standard telemedicine unit, including a small audio console, a camera that can zoom in and out, and a monitor, costs less than $2,000. Elderly inmates are more susceptible to chronic medical and mental conditions, including dementia, impaired mobility, and loss of hearing and vision, all which require constant medical attention. Inmates are screened for infectious disease upon arrival. Screening includes sexually transmitted diseases and tuberculosis. Appropriate action is taken when problems are identified. Annual flu protocols are in place at each institution. Institutions will have on-site infirmaries, which provide observations and care by licensed healthcare staff. When inmates require hospitalization, community hospitals are used. All major institutions and some of the smaller camps are staffed with mental health professionals and can provide outpatient mental health services. All major institutions can provide temporary or short-term inpatient psychiatric care for crisis management and stabilization. If higher-level chronic care is required, it is provided in specialized residential mental health treatment units. As future healthcare providers, we should be making an effort to ensure that all individuals have equal opportunity to receive basic healthcare and access a decent quality of life. Estelle v. Gamble was a 1976 Supreme Court case that focused on the poor quality of healthcare for incarcerated inmates. J.W. Gamble was injured after a 600-pound barrel of cotton fell on him during his textile work. He was seen 17 different times by physicians who ultimately only gave him mild pain pills. He refused to work due to the excruciating pain of his injury and was forced into solitary confinement due to his refusal to return to the textile mill. On February 11, 1974, Gamble signed a pro se complaint alleging that the prison subjected him to cruel and unusual punishment in violation of the Eighth Amendment on the grounds that 1. The prison failed to diagnose his back injury by giving him an x-ray. 2. The prison provided no real treatment for Gamble's back injury. And 3. That Gamble was essentially placed in solitary confinement due to substandard medical care. The court voted 8-1, with Thurgood Marshall leading the majority opinion. Though the court credited Gamble's complaint that the doctor had failed to provide appropriate care, it held that medical malpractice did not rise to the level of cruel and unusual punishment simply because the victim is a prisoner. Due to low standards set in the precedent of previous court cases, it is now up to future providers to fight for increased accessibility in order to provide a decent quality of life. Federal, state, and women's prisons are all shown to be lacking in the proper material to ensure full coverage of their inmates, as well as setting rules and limitations that make it even more difficult for the inmates to obtain basic care.